Happy Medical Monday, everybody. Coming at you live from Greenhouse Wellness. Dr. Leslie Apgar. I've got the fabulous Sierra behind the camera.
Hi.
Hello, hello, hello. So listen, you guys, we have been getting so many questions, kind of basic questions. I thought we would take it back a notch and kind of do a primer for beginners, cannabis for beginners. Starting out with, how do I participate in this program? How do I get my card? I can't tell you where I am in my world, whether I'm at the gym, I'm at the store, I'm at my other business, and everybody stops and says, how can I become a patient? So let's go over the basics, guys. You can always go to greenhousewellness.com and follow the directions, step 1, 2, 3. Or you can go right to the MMCC website, mmcc.maryland.gov, and you can fill out your application online. You need your driver's license, you need to take a picture of yourself on a white background, and we can always help you do that if you're having a hard time getting yourself registered. That's the rate limiting step, guys. That's the 16-digit alphanumeric number. Once you have that, then you can look on that same website for a list of certifying physicians. I am not a certifying physician, you guys. You cannot make an appointment with me and come in here and get certified because I have ownership in Greenhouse, so it is prohibitive. So I am not a certifying physician, but you can go to one, and there's a whole list on the website. And then step number 3, now you can come into the glorious Greenhouse or any dispensary and be taken care of by our amazing wellness consultants and get your medicine. Okay, so that's how you get a card, all right? I wanted to talk about when you finally do get here as a new patient. I've had a lot of patients with some really good questions, and I'm just gonna kind of walk you through what we do when you get here. Number 1, hi, how are you? It's so nice to see you. How can we help you? What are we trying to treat? What have you tried before? Have you ever tried cannabis before? And then finally, we'll delve into the cannabis medicine with you. So number 1, we have to talk about delivery systems. There's so many different ways of getting cannabis in your system, and people have preconceived ideas about that it's only smoking or vaping, and it's not. It's very complicated, and there's a lot of awesome options that we have to offer you. So that's the first thing we're going to talk about. Then we're going to ask you to start with a CBD option, cannabidiol, which is the non-intoxicating major cannabinoid in cannabis. It's the one that does not make you high, but it has a lot of anti-inflammatory and anti-cancer and all kinds of wonderful properties in it. And that's what we're going to start with, okay? And we're going to start you at about 15 to 20 milligrams 2 to 3 times a day, okay? And then we're going to start adding THC to that in very small increments, starting as low as 1.5 to 2.5 milligrams of THC, especially for those who are older and who have never tried any kind of cannabis. And that we're going to increase every 3 days or so, depending. Now remember, cannabis has a strange biphasic effect. So at very low doses, it's stimulating, but if you go to high doses, it's sedating. So more is not better when it comes to THC. We have to be very aware of that. It's a very strange molecule in that way. We're also going to ask that you journal your reactions and your side effects, if any, and your positive experiences. We want you to journal so that you can keep track of it, because it's confusing. There's a lot of different medications around, and you're going to get confused yourself. So we love it when you journal your results. And then we also recommend that every 3 or 4 months you take a break from your medicine, because it actually desensitizes your receptors, and then they'll start working better, and then you can go back and use lower doses. Spend less money on your medicine, guys. Let's be real here, right? So that's another thing that we would recommend. Also, in about 16 weeks, if you haven't seen significant improvement, then cannabis may not be for you, or you may not be taking the correct dose. And in that case, you probably do want to make an appointment with one of our wellness consultants so we can make sure that you're doing it as best as you can. Okay, another big question always asked to me are side effects. Dr. Apgar, what is this going to do to me when I take it? I'm going to go through the most common side effects, okay? Number 1, dizziness. Okay, dizziness by far the most common side effect. And the reason is that especially when you inhale THC, it causes an increase in your heart rate transiently, very briefly, but that then reflexively lowers your blood pressure. And as a result, you might feel dizzy or kind of woozy. And obviously, especially in our elderly population, we always want to be aware that those patients are at a risk for a fall or an injury. So we want to be very cautious with that. That's the most common side effect reported. Number 2, we talk about dry mouth. I think everybody's very familiar with that side effect. We always encourage you to drink a lot of water if that happens. Number 3, drowsiness or fatigue. And then cough is associated with smoking. And obviously here at Greenhouse, we very much recommend vaping or other delivery systems over smoking, which we won't get into today. Anxiety is usually a result of taking too high of THC, but we do want to be aware of that. And then nausea, okay? And the endocannabinoid system that we're all born with is really very concentrated in our gut. And so obviously when those receptors are stimulated by cannabis, you can get either the feeling where you're hungry or you're a little nauseated. Those are very, very common side effects. Now, next, I do have some patients that are pretty sick, and they have asked me specifically about cardiac or heart side effects. And I wanted to talk to you guys about a study that I found that was very interesting. It was actually a study on heart attacks in mice. And they found that when the mice who had a heart attack were given CBD, that they had a 66% reduction in the size of the infarct. So somehow CBD is reperfusing damaged tissue in a way that is not defined, because it happens even in an oxygen deficient state. So there is some sort of black magic happening here, which I love. But it seems to be very, very safe for patients who have cardiac damage or who have cardiac issues. So that's good to know. Number 2 on our concerns, we do have a lot here at Greenhouse Wellness of patients with anxiety. A lot of anxiety, a lot of PTSD, and I get a lot of my first-time users who are very concerned that their anxiety or their irritability is going to be worse from taking cannabis. And so obviously, guys, go slow, start low, right? It's low doses of THC that are going to protect you from that. As you start going up higher in your THC dose, yes, there's an increased risk of irritability and anxiety and paranoia and things like that. But if you stick with the high CBD, low THC formulations, you should be just fine. And last, but certainly not least, we certainly take care of some very, very sick patients and very immunocompromised patients, either patients that are on chemotherapy for their cancer or who are taking medicines for, say, inflammatory bowel disease or rheumatoid arthritis, and their immune systems are compromised. So a lot of patients say, hey, Dr. Apgar, is this safe with all of these medicines that I'm on and in my current state? And it turns out that yes, it is very, very safe. Cannabis actually supports your immune system. The only caveat I want to give is that if you have an active bacterial infection, if you're actively taking antibiotics and you're very sick with a bacterial infection, you want to avoid very high doses of THC, because that can have a negative impact on your body's ability to fight off infection. So CBD, great in high doses, but THC in high doses with that situation you want to avoid. So yes, we're constantly looking out for you guys, looking at all the data that we can find. I love it when you ask me questions like this so I can do my due diligence and get back to you. If you think of anything else that you'd like us to target and answer here at Greenhouse, Sierra and I will be happy to do so for you. We are just, again, grateful to be here for you, and so grateful in this holiday season to see your shining faces. I know it's rocking and rolling out there right now, so come on by and see us. We have our, 8 crazy nights of Hanukkah.
Yes.
And today we're doing $39 disposable pens. So come on in and take advantage. Okay, we can't wait to see you guys next time. Talk to you soon. Bye-bye.